First, I would like to thank my Professor Dr. Samir Ansari for his great effort during these 6 months of continuous medical education through the mega online course and academy. Second, I would like to thank Dr. Saad Mahdi for his scientific support for all our colleagues. Lastly, my colleague Dr. Sarawat Habib success in the diploma, European diploma today, and I am happy for him. He is from lecture of anesthesia from Mansoura University. And lastly, I will introduce my colleague and my friend from Damietta, basically Dr. Yasser Reda. Yasser Reda is a professor of anesthesia, pain, and ICU in National Cancer Institute, Cairo. He worked in Saudi Arab and in Qatar, and he got a lot of certification in ultrasound-guided nerve block, in regional anesthesia, and in ICU. And he's the moderator of block room in Hamad Medical Center in Doha, Qatar. And it is a very nice idea to have a block room for all the theaters. He is the magic, he has a magic hand, and he do block for all the patient and follow up those patients after the operation, at the end of the operation, to provide post-operative analgesia. So I am proud to introduce my colleague and my friend, Dr. Yasser Reda, and welcome, Dr. Yasser.
Thank you, Prof. Makharita, and thank you, Dr. Saad, and thanks a lot for the attendee. I just make a little joke about this funny lecture. It is an awesome PowerPoint presentation, how to make a presentation. And really, it is a very squeezed time, so I just will, I think not to go fast, I'm just making like a message, like a small or just a mini lecture about how to make an awesome PowerPoint presentation. And also I will make my presentation to be as long as possible to cover the subject and to be as short as possible, not to get bored or to fall asleep. You know that one of the biggest challenges in our life as a doctors, when I attend the medical school and I hear a word like superficial fascia, from anterior to posterior, and tensor fascia lata, and this funny thing, I still continue to hear this word and to still continue to study in the university until I reached to a word like pseudomembranous colitis and systemic lupus erythematosus, and they still continue. Which make me to continue in this medical school. This is a matter of fact because of a great teacher and a great speaker to me. So as a matter of fact, also there is not all the professionals are the good speakers, and not all the good speakers are professionals. And by training and how to improve your communication skills, you can make yourself a good speaker. And there is many courses, and I attend one of these courses. It makes a big difference to me. No one is ideal, but also you can just improve your communication skill by these lectures. I don't have any disclosure or support from any places, and everything is free, as Dr. Makharita said. This is my beautiful Damietta, as Dr. Makharita said, this is Russell Bar, and this is my city, which I born there. And I'm not speaking for the beginners, I speak also for the professional, because many professionals can't be a good speaker, and if with a little training can be a good speaker. And you must know no one is perfect. Why pencils have a eraser all the time to erase what they did. Most of us is a very professional in our work and spending their time and life to make a good job, and we can make a very good experience. But our problem, he just want to transmit the knowledge from academic to clinical part. In every lecture, you must introduce yourself, because some people don't know who are you. So who I am. So I am the young one, this is anesthesia doctor, all the people is sleeping and still awake. And when I grow up, I become Yasser Reda. And this is how can I do my job to sleep in the people. And this is my hand in OR. And this is my communication center. And this is how I concentrate or sleep, no difference. And this is how I feel myself in OR. And here I know my priority. This is the life of the patient, not just to fix the procedure. So science is fun. and I must feel the power of PowerPoint to introduce myself. And the presentation usually is not your work. It is a group work. So you must thank your group, because, you know, to bring this presentation to the life is a work of group, not work for yourself. What is the presentation? It is just a question. So what is the presentation? It is a relationship between what's called speaker and attendee. And the main target for the presentation to send a message. So whatever you have a message to send the message, send the message. And you can use whatever you can use to send the message in a respectable way. So it is a communication skills between speaker and attendees. And now with an webinars, this is a challenging, because many of the skills you can't use through the internet, but you have a target for your lecture, and you must have a message for your lecture. Many times you see a lecture without any message. At the end, you don't know what he wants to say. He make a lot of challenge, a lot of controversy, but you don't know what is the target, what's the conclusion of this message. So before you make any presentation, you must have a time to preparation and to make a design for your lecture and to make how to deliver your lecture. It's very important. And all the time you must be thinking about introduction, subject and conclusion, or the home message. This is very important. So this is only some advice how to make a presentation. So some preparation key point, usually respect your time to prepare the lecture, and respect time for the attendance. Also prepare your story on introduction, and practice. Always ask yourself why. Don't write anything in your lecture without knowing why, because at the end someone asking you about this and you can't answer. And the other problem about the practice and updating, some of us make a lecture, and after 3 years make the same lecture, and after 4 years make the same lecture without updating. It will be just expired or out of fashion, and you don't know. So you must update yourself all the time. And what is the subject to design? You can make a subject, like a subject or PowerPoint presentation. You can make point or sub-point, or just you can another thing to make a transfer slide to slide, every slide completing the slide before. So there is many studies and research in this issue, like a study in medicine. What is the most important thing about the lecture? If you ask a question or you make a lecture to tell the patient at the end what you need from this lecture, all people will excited to see what's the end. So the presentation approach should be personal history, topical, appropriate, induced together, something understand by everyone, and to be appropriate for the medicine. For example, you can't tell me in a lecture why all dog will not go to the heaven. For me, if you come to me as a monitor and tell me I need a lecture for neurosurgery, I will tell you no, because I don't work for neurosurgery for many years. So mastering everything is mastering is nothing. And you must be looking for the good background and good lecture and good slide all the time. Don't put a slide like this or very crowded. And you must speak with the people with a language they understand. Don't bring another language to speak about philosophy for a scientist. And most of the time, if you use a video or animation, it will be okay. And because our study is tough, you must put some humor in your medicine. Sorry, not this to that extent. It will be a little humor. So a presentation, I must thank you and thank everyone, as this is a handling a flower, because I appreciate your time and your money also and everything about you come to attend this lecture. And if you give respect, you will get a respect again, even for a life thing. So how to start your lecture? You can ask a question, but supposed to be yes or no. Don't open a discussion because it's wasting your time. Or just to tell a story, or to tell just an introduction about the lecture, it will be okay. So for example, should I lose some weight? Yes or no? That's it. Also you can start like a story, or to be simple, clear, vibrant, and not a heavy presentation. Everyone can understand what you said. Like some people starting like telling the story of McDonald's to speak about the economy, or just to speak like a Martin Luther King when he said darkness can't drive our darkness, only light can do that. Hate can't drive our hate, only love can do that, for example. And you must know that concentration capability is very little, even especially for medical professional. You know, most of the studies showing it is from 7 to 12 minutes maximum. So you must make a presentation and to make a joke, to make something funny, to make something interesting, to make the people to wake up, because no one can concentrate more than 12 minutes. It's, you know, that is for a clear mind people. But for us, I think the time less than that. So you must make something every 7 to 8 to 12 minutes, like and make a new lecture. So all the time, concentration is paramount. Now, where was I? And this is like to put cold water in your face, or to get a bite by beans. And communication skills also to come early and check electronics, because this is a very problematic thing. Even make a stress for the speaker, for the audience, and wasting the time. And to wear also time to wear an official dress, but not to come with a bodyguard. Don't I mean with bodyguard, just to be an official dress and to introduce yourself. And don't lifting many stuff, get the power of PowerPoint. And you must remember all the time, the attendee is your student, not your judge. And they speak like this, but fear is normal. And they speak like this because you are the most professional in your topic, because you read a lot, you make an update, you make an search, and also read good and make a good training even in front of the mirror. Be funny most of the time, because people like to laugh, and be a of time, confident, not to be paranoid, and to put some humor, and to make a use body language 1, 2, 3, and use body language is very important. And you must concentrate, because fear is normal, but you must treating the people like your student, not like your judge. And if you come fast and you don't prepare yourself, you can bring this heater for sandwich instead for your computer. Update, as I told you, and to must be concise. Presentation is your for your audience, not for yourself. You must give a message. When you speak, for example, with a doctor, is different from a nurse, different from the public. And usually use examples, example to be simple and palatable. And the problematic thing, don't try to tell everything you know, because you need a very long time. You need to send the message in a good way. So, and also if you speak about a subject, you must go deeper more than wider. For example, if you speak about risk factor and you speak about smoking, don't speak a lot about smoking, because this is just a risky factor. Don't go deeper, not to go and wider, and keep organized mind map in your content in your brain. And this is 5 things you make your presentation very good, or just wow presentation. First thing, using the animation or just a picture, because this picture can express the reason for this fracture. So 80% of the word can be replaced by image. And here, if you speak about retrograde intubation, very easy to see this the horn coming from the mouth. And you can know that this man is a medical doctor and his wife is a fashion designer. Very easy to know from this picture. And you must know from this picture, this is a car owned by a beautiful lady, because all people here, 60 people, like a mechanics. So with training, everything become okay. And even Mr. Bean can make a body build. For me, I started like a volunteer, I ended like a speaker. So another thing about that, do something funny in your together. So the technician for the machine come to me and telling me the machine not working, I have a problem with the machine, and tell me the motherboard have a problem. So I told them, I don't care about motherboard or fatherboard, I care about the machine to work. So you must make something funny in your lecture, and not to that extent again. Thank your audience all the time, because as I told Dr. Muhammad speak about the money and time, and to be vibrant, don't to make monotonous, like this, to be vibrant all the time, to make the people to have an energy to be away, and respect the time, and also don't read your slide. If you read your slide, everyone can read the book, and you don't attend your lecture. And also 5 reasons again is that to make your presentation is bombing and no one can tolerate you. Don't respect your audience time. It's very important. No value of your presentation when you speak about the presentation away from the specialty of those people. Not inject some sense of humor. You were not prepared and apologize. And also you use that technology to show your talent and away from the subject. So this bombing your lecture, and sometimes you kill the people by PowerPoint presentation. And at the end, dear God, when will this presentation end? I will finish very fast. So this by PowerPoint presentation, and this is how everything is developed. Start like this early PowerPoint presentation, coming like this later, and at the end it will be suckling of the baby for like and food. So what is the perfect presentation? What is the method to plan and design delivery? How many slides should I have? How much time for every slide? What is the side and font is the best? No answer, because there is many study and showing at the end many method like listening method, numerous slides, simple design, Kawasaki, put a number, Xenon, no rules, Takashi, which I just go for this, my lecture going to this more, big text, many impressive graphic and animation, and I know the time is squeezing, so my conclusion, PowerPoint presentation is art and science, shows the best subject for the audience, and must make an audience interaction, don't be monotonous, don't read your slide, design include introduction, main subject, and conclusion. Make an effort with update knowledge. Less text, more listening, because you are the lecture, not the slides. Presentation training, and you must take opinion of your colleague. I take 3 opinion of my colleague for this lecture before I come here. Give example and make a joke all the time. Use picture, animation, and provide. Be simple and reliable and concise. Try to use all the help available. Because no one notice your tears, no one notice your sadness, no one notice your pains, but everyone can notice your mistake. At the end, my presentation is awesome. Yes, very all of the above. I think is the answer all of the above. And thank you very much for attending and for listening.
Thank you دكتور ياسر رضا. انت مالكش حل. منور يا باشا.
Many thanks, Dr. Yasser. Many thanks, Dr.